Today we are taping the NUR 365 revised Administering IV Push and IV Piggyback Medications Formal Competency. And our student nurse today will be Sarah Enriquez. She will begin by verifying the healthcare provider's orders with the medication administration record.
My order is verified. I'll be given diphenhydramine or Benadryl IV push and ceftriaxone IV piggyback.
Okay. Verify patient allergies.
The patient is allergic to bananas and morphine, which will not affect our procedure today.
Research the medications, including classifications and actions, indications, dosage range and routes, desired therapeutic effects, adverse effects, and nursing implications. Sarah will also check for pre-administration assessments that she needs to do, such as lab or vital signs. She will also check compatibility with the primary IV solution and the length of administration time.
I've completed researching my medication.
Perform hand hygiene. Pull the medications and saline flushes and check expiration dates.
I've pulled my medication and checked expiration date.
Gather the necessary equipment and supplies. 0.9% sodium chloride 10 ml flush, alcohol prep pads, swab caps, appropriately sized syringes, necessary equipment for medication preparation, such as a filter straw or blunt tip needle, and secondary tubing. Perform the first check of the 5 rights of medication administration, comparing to the MAR for each medication, including flushes: patient, medication, dose, route, and time.
I have IV practice, date of birth 3/3/87. Diphenhydramine or Benadryl, 12.5 milligrams, IV push every 6 hours. The time is now. I have diphenhydramine, 10 milligrams per ml. IV practice, date of birth 3/3/87. Ceftriaxone 1 gram, IV piggyback daily. The time is now. I have ceftriaxone 1 gram and 0.9 sodium chloride 50 mLs for IV practice. Date of birth 3/3/87. 0.9 sodium chloride 10 ml IV push PRN flush. I have 0.9 sodium chloride flush syringe. IV practice, date of birth 3/3/87. 0.9 sodium chloride 10 ml IV push PRN flush. I have normal saline IV flush 10 mLs.
Prepare the IV push medication with correct calculation for dosage and infusion rate.
I need 12.5 milligrams of Benadryl or diphenhydramine. I have 10 milligrams per ml. I'll use a calculator if I need, and I'll be administering 1.25 ml. I'll be pushing this medication at 0.5 to 6 mLs per 30 seconds. I have ceftriaxone 1 gram and 50 mLs of sodium chloride. I need to give 50 mLs over 30 minutes. There's 60 minutes in 1 hour. I'll be administering this IV Piggyback medication at 100 mLs per hour.
Okay. She will disinfect the vial by cleansing the access diaphragm using friction in an alcohol prep pad and then allowing it to dry for at least 15 seconds.
I have a 3 ml syringe.
She will draw up the medication using aseptic technique. She will now label the medication syringe with date, time, patient initials, her initials, along with the name and dose of the contents of the syringe. And Sarah has already performed the next step, which is calculating correct rate of IV Piggyback infusion. And she stated her findings. So she will now perform a second check of the 5 rights of medication administration, comparing to the MAR for all medications to be administered, including saline flushes.
I have IV practice, date of birth 3/3/87. Diphenhydramine or Benadryl, 12.5 milligrams IV, push every 6 hours. The time is now. I have diphenhydramine, 12.5 milligrams and 1.25 mLs. IV practice, date of birth 3/3/87. Ceftriaxone, 1 gram IV Piggyback daily. The time is now. I have ceftriaxone, 1 gram IV. IV practice, date of birth 3/3/87. 0.9 sodium chloride, 10 ml IV push PRN flush. I have sodium chloride 10 ml flush syringe. IV practice, date of birth 3/3/87. 0.9 sodium chloride, 10 ml IV push PRN flush. I have 10 ml sodium chloride flush.
This time, perform hand hygiene and provide patient privacy.
I'm going to pull your curtain for privacy.
Introduce self to patient and family and add your credentials.
Hi, I'm Sarah. I'm a student nurse. I'm going to be giving you some IV medication today. There's no family present.
Identify the patient using 2 patient identifiers. Compare with the MAR or medical record and scan the patient.
Can you tell me your name and date of birth? Great, thank you.
Verify patient allergies.
And do you have any allergies? Okay, that won't affect our procedure today.
Perform the 3rd check of the rights of medication administration comparing to the MAR and scan the meds.
I have IV practice, date of birth 3/3/87. Diphenhydramine or Benadryl, 12.5 milligrams, IV push every 6 hours. I have Benadryl, 12.5 milligrams and 1.25 mLs. IV practice, date of birth 3/3/87. I have ceftriaxone, 1 gram IV Piggyback daily, and the time is now. And I have ceftriaxone, 1 gram, in 0.9 sodium chloride, 50 mLs. IV practice, date of birth 3/3/87. 0.9 sodium chloride, 10 ml IV push, PRN flush. And I have 0.9 sodium chloride flush syringe, 10 ml. IV practice, date of birth 3/3/87. 0.9 sodium chloride, 10 ml IV push, PRN flush. And I have 0.9 sodium chloride, 10 ml IV flush.
Discuss with the patient the purpose of each medication, expected action, and possible adverse effects. Explain that you will give the medication through the patient's existing IV and allow the patient to ask questions. Raise the bed to a comfortable working height.
I'm just going to raise your bed up, Ivy.
Apply clean gloves. Assess the site for any signs of phlebitis or infiltration. Encourage the patient to report any signs of IV site discomfort.
Do you have any pain at your IV site, Ivy? Great.
Remove gloves, perform hand hygiene, and apply clean gloves. Sarah is getting ready to do the IV push medication at this time, so she must confirm if it's compatible with the IV solution.
For the purposes of this video, we're going to assume that our IV push medication is not compatible with our infusing IV solution.
Okay, in that case, she has to stop infusion of the primary and clamp the line. Cleanse the injection port with alcohol prep pad by scrubbing for 15 seconds and allow to dry completely.
If an alcohol swab cap was present, I would not need to clean with an alcohol prep pad.
Connect the 10 ml 0.9% saline flush syringe into the injection port using push and twist technique. Pull back gently on the plunger to aspirate for blood return.
I have blood return.
Slowly flush injection port with saline flush. Disconnect saline flush and cleanse injection port with alcohol prep pad by scrubbing for 15 seconds and allow to dry completely. Connect medication syringe to the IV injection port. Inject the medication within the amount of time recommended by the drug reference manual at 15 or 30-second intervals. Use a watch or clock to time the administration.
I'm using the clock on the wall, and I'm pushing 0.6 mLs every 30 seconds.
Observe for adverse effects and infiltration with each push.
The medication is now completed.
Disconnect the syringe. Clean the injection port with a new alcohol prep pad and allow it to dry. Attach a new normal saline flush and inject at least 3 ml or 10 ml if medication and primary fluid not compatible, which is the case. So she's going to use the 10 mLs. At the same rate at which the medication was administered. So she's going to be watching the clock again.
I'm pushing my first 3 mLs by injecting 0.6 mLs every 30 seconds, watching the clock. My first 3 mLs has infused. Now I'll push the last 7 mLs of the flush at a slow and steady rate.
After injecting the flush, disconnect the syringe and unclamp the line. Apply a new swab cap to the IV push injection port and restart IV pump at correct infusion rate. Sarah will stay with the patient for several minutes and observe for any adverse or allergic reaction.
.9 normal saline, rate is 100, volume to be infused. There's about 500 left in the bag. Checking the line to make sure the clamps are open and the green light is on, watching the drip chamber to make sure the IV fluid is infusing.
Dispose of used supplies in appropriate containers. Remove gloves, perform hand hygiene, and apply clean gloves. I'm going to be moving on to the IV Piggyback at this time. Going to prepare her secondary tubing, so close the clamp on the secondary tubing and connect tubing to the IV Piggyback medication without contamination. Cleanse the medication port closest to the primary IV fluid and allow to dry or remove the swab cap.
Since there's no swab cap on this port, I'm going to cleanse it for 15 seconds with an alcohol prep pad and allow it to fully dry.
Attach the IV Piggyback tubing without contamination. Back prime the secondary tubing utilizing aseptic technique until the drip chamber is half full. Try not to lose any of the medication.
The chamber's half full. I'm just going to lift my medication up.
Close the roller clamp on the secondary line and hang the IV Piggyback on the IV pole. Then use the hanger from the secondary tubing set to lower the primary IV solution. IV Piggyback medication should now hang higher than the primary IV solution. Program the IV infusion pump for the secondary rate and volume to be infused.
Channel select, secondary. I'm going to find my medication. Choose the correct dose and volume. Verify that that's correct. Verify again. Press next to confirm. Verify the secondary clamp is open and then press start. I'm going to watch that the green light is on the IV pump and that I see my IV Piggyback medication dripping in the drip chamber.
Label the secondary tubing and dispose of used supplies. Document medication administration on the MAR, 6th right. Scan your ID badge. Observe the patient's IV site for infiltration and stay with the patient for the first several minutes to observe for any adverse reaction. Okay, and that really is the end of the scenario here, but you do have some things to do for completion of IV piggyback infusion. All of the following must be stated by the student. Once the IV piggyback is complete, the force of gravity will automatically restart the primary infusion on a continuous IV. Must return to observe the patient, close the roller clamp on the secondary tubing, do not disconnect the tubing. Return the primary IV solution to its original place on the IV pole. Check the primary IV drop chamber. Check the infusion pump to verify that the pump is returned to the prescribed rate of infusion. Also be sure to document any problems with the IV site, adverse reactions, and any special monitoring that was performed. Help the patient into a comfortable position and place toiletries and personal items within reach. Place the call light within easy reach and make sure the patient knows how to use it to summon assistance. To ensure patient safety, raise the appropriate number of side rails and lower the bed to the lowest position. Remove gloves and perform hand hygiene.
Which I've already done.
And Sarah has maintained professional demeanor and language and safety throughout the procedure, so the procedure is complete.